Good afternoon. My name is Patsy Guerra, and I'm with the Texas A&M Health Science Center Coastal Bend Health Education Diabetes Program. Today I would like to talk to you about what is diabetes. Diabetes is a chronic or long-standing disease that involves the management or the control of our blood sugars in our bloodstream. When we eat, our body converts carbohydrate foods into sugar or glucose as a form of energy. When our blood sugar levels rise, our pancreas releases insulin in order to allow that sugar to go into our body cells by acting as a key that opens up the body cells and allows the sugars to be absorbed into the cells as energy. We do need to have sugar in our daily diet in the form of carbohydrate. Many times people will hear, well, we need to have sugar, and so then they'll eat sugar. And sugar in its refined form, such as sugar added to tea or sugar added to coffee, is not something a person with diabetes would want to consume because that will raise their sugars quickly. The foods that we eat when they are refined carbohydrates raise our sugar much faster. If they are in complex carbohydrate form, the rise in the blood sugar will be slower. And so when we have diabetes, we have an issue with the insulin either not being produced enough by the pancreas to be able to manage the amount of sugar that is in the bloodstream, or it makes insulin and the body does not recognize the presence of this insulin, and therefore we do not have a controlled blood sugar level. Regardless of whether it's the resistance to the insulin by not recognizing the presence of the insulin in the bloodstream or not enough insulin in the bloodstream, the end result is an elevated blood sugar. The problem with having an elevated blood sugar for a person who has not been diagnosed with diabetes is that by the time that person gets diagnosed with diabetes, they may have had the diabetes already for almost 5 years. Uncontrolled blood sugars from a period of 7 to 10 years begin to damage the organs of the body, begin to damage the eyes, begin to damage the kidneys, the nerve endings, and so we end up having complications in our health because of elevated blood sugars. So it's important then that everyone who has a history of a family member that has diabetes or knows that they have had diabetes when they were pregnant with gestational diabetes, that they get monitored or checked for diabetes at least every year or every 2 years to make sure that they do not develop diabetes. If you develop diabetes, then the good news is that you can manage your diabetes by following the medications prescribed, by being active and increasing your activity level by exercising 30 minutes a day, 5 days out of the week. This exercise helps to keep your blood sugars from getting elevated because the insulin that you do carry in your bloodstream becomes more active and it works better and absorbs the sugars into the cells. There is a multitude of information out in the market regarding medications, regarding the treatment of diabetes. Some of it is propaganda for herbs and for unconventional forms of diabetes treatment. Before choosing to follow these, please be sure that you seek medical attention from your doctor. Please be sure to seek information, whether it is via the internet or by attending classes such as the classes that we offer through the Texas A&M Diabetes Program, or call us here at our office. Our 1-800 number is 1-866-524-1408. Again, that number is 1-866-524-1408. Thank you.